Okay. Can you find this page for me in your textbook? I don't know where it is. Somebody got a number for me? Isabelle's trying. See if she gets it first. There it is. 537 is the number. 537 is the number. And what this is doing, my friends, is giving you an overview of the menstrual cycle from both the hormonal perspective, from the follicular perspective, and from the uterine perspective, all in one amazing graph, chart, picture. So let's take a look first at the top, which is the hormones. So you have an average of a 28-day menstrual cycle, and we're talking about basically from the onset, the start of menses, the bleeding, until the next round. And that is an average. It's not an everybody is precisely 28 days. A single woman will have multiple different times. Some months is 28 and 29 or 26 or 32. It depends. Okay? But usually fairly regular. You have two large spikes of hormones that occur right about day 14. You have a spike of luteinizing hormone and a spike of follicle-stimulating hormone. What happens on day 14? Do you know? Ovulation. What is ovulation? The egg is released. The ovum, the egg, is ovulated. Makes sense, right? It's released. It has gradually matured and developed by these hormone levels increasing, and then with that spike, it causes the egg to be released from the follicle. You notice in this third graph here that there is that nice gentle cresting of estrogen at the same time. Are y'all with me? So there's three hormones that all peak all at the same time at day 14. Or, excuse me, when ovulation occurs. It doesn't have to always be exactly day 14, but when ovulation occurs. Luteinizing hormone, follicle-stimulating hormone, and estrogen. Are you with me? Then, of course, those levels drop off very, very, very quickly. Those hormones are things that can be used to determine when ovulation occurs. Because let's say that you are a woman who's having difficulty getting pregnant, or you and your husband want to get pregnant, and there are urine tests that actually will measure the amount of estrogen in your urine, because it does translate. When there's this spike, it'll show up in these urine tests. And of course, this will tell you, hey, this is the time for us to have sex because you're more likely to get pregnant at that time, right? Do you notice, stay with me guys, do you notice that there's also another spike that happens in the hormones? And that's this green graph, and that is progesterone. If you look at the progesterone graph, and you look at the thickness of the endometrium graph, the one on the bottom, can you see that those things are related? Like, doesn't the shape look almost exactly the same? The gradual increase of progesterone over the course of the last half of the cycle, the gradual thickening of that endometrium. Remember, that's the inside layer of the uterus. So this is basically the uterus preparing itself for the egg to implant. Because the egg's going to be released about here, right? So we want to start growing and thickening and getting that endometrium nice and ready for that fertilized egg, if it does get fertilized, to implant into the uterus. If there's no fertilized egg, there's no implantation, then that endometrium, you see, goes from being super thick to very quickly sloughing off and being back to normal. That is what the period is. It's the removing of that inside layer of the endometrium. and then the whole process starts again. Are you with me? I think this is a very well done graph because it gives you tons of information all in one particular place. Yes, ma'am. They have two different chemical compounds, and they have two different usages for them. They're both produced by the ovaries, so that they have similarities to them, but they are different. They have different pieces that they work toward. Yeah, and we'll talk in more detail about those guys. Okay. The mammary glands. These are accessory organs of the female reproductive system. So, again, not primary organs, right? What is the primary organ of the female reproductive system? The ovaries, right? The ovaries, because those are what produce the eggs. What is the purpose of these mammary glands? They are specialized to produce and secrete milk after pregnancy, right? And that breast milk, even though we do a great job of producing synthetic milk, it still cannot compare to breast milk. Breast milk is still the best. No matter what you hear from different advertisements, breast milk is definitely the best. Why? Can anybody, what other benefits do breast milk give other than just simply nutrition? Give me here. I hear lots of these comments, but I can't.
Bacteria, so immunity, kind of
Absolutely. So there's a huge piece of immunity that comes in. The very first milk that the mother produces for the baby is called colostrum. We'll talk about this in the next unit. But that has a huge dose of antibodies. I'm like, what is the name of the things that it produces? Yes, the antibodies. Which, again, this baby is now suddenly interacting with a world that has millions of viruses and bacteria that's never been associated with before. So that's a huge piece. Another one is the fact that there's actually bonding that takes place by when that mother is nursing. It's releasing hormones that are increasing the bond between the mother and the baby. And you may say, well, of course she loves her baby. Well, when it's like 2 o'clock in the morning, 3 weeks after you, and you're hurting, and no, you need that bonding. You need that good time, pardon me. Okay, sorry about that. Okay, anatomy pieces. The mammary glands are located within the breast on the anterior thorax. So there's a difference between the breast and the mammary glands. The mammary glands are the actual epithelium that are producing the milk. Does that make sense? But they're contained within the breast. You have this area on the very tip called the nipple, surrounded by a pigmented skin called the areola. And here inside, you see those glands, those mammary glands that are producing that milk. On the outside, again, there is muscle underneath there. That pectoralis major and minor muscle are underneath the breast tissue. So women do have those muscles. They're just covered up by the breast. There is good large deposits of adipose tissue that are in there. The question always comes every year, why do men have breasts? There is no good answer for that question. That's the way God made us. There's actually even a couple of books by that title, like one of those question and answer kind of books. And all of them say, we don't know. Yeah, sorry, we don't know. Certainly, I can't pass without saying how important or how prevalent breast cancer is in women, and how important it is to be able to do self-checks of your breasts. Certainly at your age, Ladies, you should be comfortable doing that and should know. Basically, you're just seeing, are there differences, right? If you have an ideal of how things feel now, if something changes, you're aware of it. And the sooner you sense changes, sooner you feel changes, the better. Guys, it's the same thing with your testicles. You should be performing testicular exams. I know it sounds crazy, but it's true, because these are the two main areas of cancer for guys and girls. You should be comfortable understanding those differences. Any questions there? That's really all I wanted to get through. So, yes?
Why do they, girls' breasts grow and hurt right before puberty?
It would be because of the hormonal changes that they do actually affect the tissue themselves. Exactly what? I don't know, to be honest with you. But there are changes. There are differences, even throughout the hormonal cycle, throughout the menstrual period cycle, during pregnancy, after pregnancy. It's very interesting that there are just changes that happen. It's not like you're one static size over the course of a period of time. It changes. Yeah. Interesting. Other questions? Okay. I'm stopping this then. I would love for you to spend the rest of this time on your questions, please.